the first randomized controlled trial for total knee replacements and Iovera. And what they did was they randomized their total knee replacements to get Iovera versus non-Iovera, and then they used periarticular injections in the non-Iovera group to represent the nerve areas that were being blocked by Iovera, so they could try to provide some anatomic consistencies between the Iovera group and the non-Iovera group. And then they followed the patients out. And what they found was up to a 35% reduction in opiates consumed. So this is pills taken, not narcotics prescribed, but pills taken in the Iovera group compared to the non-Iovera group. And actually what's more compelling is that 6 weeks, only 15% of the Iovera patients were still taking narcotics, whereas 40% of the non-Iovera patients were still taking narcotics at 6 weeks. So the Iovera patients were able to become opiate-free much sooner than the non-Iovera group. And to me, that's actually more important and more compelling than actual total opiates consumed. It's how quickly can you get off the opiates? How quickly can you get to be opiate-free? And Iovera was the mechanism by which these patients were getting off of opiates as quickly as possible.